Hello, my friend. I'm Dr. Susan Parker, urologist and men's health specialist, and today I want to talk to you about something almost nobody connects with prostate health: the way you sleep. Most men think prostate problems come only from age, genetics, or bad luck. Very few stop to ask a simple question. Is my sleeping position quietly making things worse for my prostate, my bladder, and my nightly comfort? In my daily practice, I see the same pattern again and again. Small, repeated habits doing more damage than the big dramatic events. And your posture in bed, night after night, is one of those silent habits. In this conversation, I'm going to identify what I consider the worst sleeping position for your prostate health, explain why it causes trouble, and show you which positions are friendlier for your pelvis, your bladder, and your nightly rest. My aim is not to scare you, but to give you clarity and practical tools so you can support your prostate with something as simple as the way you lie down tonight. To understand why sleeping position matters, we need a quick tour of your anatomy. Your prostate is a small gland that sits just below your bladder and surrounds the urethra, the tube that carries urine out of your body. It doesn't float in space. It lives in a crowded neighborhood: the bladder above, the pelvic floor muscles below, the rectum behind, and a network of blood vessels and nerves all around it. When everything is balanced, you barely notice this area. You urinate with a good stream, you sleep several hours without rushing to the bathroom, and you wake up feeling light and relaxed in your lower abdomen and pelvis. As men get older, that balance becomes more fragile. The prostate tends to grow, the tissues can become more easily inflamed, circulation may be less efficient, and the pelvic muscles sometimes stay tighter than they should. In that situation, anything that increases pressure in the lower abdomen or restricts blood flow in the pelvis can tip the system from comfortable to irritated. The position you hold for 6, 7, or 8 hours every night becomes much more than a neutral detail. So let's name the position directly. From a prostate perspective, the worst sleeping position for most men is lying on your stomach, sleeping face down, with your abdomen and pelvis pressed into the mattress, especially if your lower back is arched and one leg is pulled up or twisted to the side. A lot of men adopt this posture because it feels familiar, or because they believe it helps their back. But for your prostate and bladder, it can create a subtle but constant problem. Picture what happens when you sleep on your stomach. Your body weight shifts forward, and a significant part of that weight rests on your lower abdomen and pelvic area. Depending on your mattress, this pressure might feel gentle or quite firm. But the key point is that it doesn't last for seconds. It lasts for hours. At the same time, your kidneys keep working through the night, making urine. Your bladder slowly fills and needs space to expand. When you are on your back or side, it can do that more freely. When you are face down, your bladder has to expand against your own body weight and the mattress underneath. For a younger man with a small prostate and good elasticity in all the pelvic tissues, this extra pressure may not cause obvious symptoms. But if you are over 45 or 50, if your prostate is already a bit enlarged, or if you often feel pelvic heaviness, that extra pressure can become a real irritant. The outlet where urine leaves the bladder is already narrower because the enlarged prostate is hugging the urethra more tightly. Now add a bladder that is being gently squeezed from the outside all night. The result is more urgency, more nighttime awakenings, and the sensation that your lower abdomen is never fully relaxed. One of the first complaints men report in this situation is, "Doctor, I keep waking up to pee 2, 3, even 4 times a night, and sometimes my bladder feels tight even when there isn't much urine." Any position that compresses the bladder while it is filling can send stronger signals to the brain, telling it to wake you up. Sleeping on your stomach encourages this because the front of your pelvis is pinned between your body and the mattress. This doesn't produce a loud pain, but it does create a constant background pressure that your nervous system interprets as urgency. There is a second issue hidden in this position: blood flow. Your prostate, like every organ, depends on steady circulation to bring in oxygen and remove waste products from its tissues. When you press your pelvis into a firm surface for hours, you can partially restrict venous return, the blood that is supposed to drain back from the area. Think about how your arm feels if you lean on it for too long: heavy, tingly, congested. Something similar, though subtler, can happen in the pelvis. A chronically congested pelvis is more prone to low-grade inflammation, which shows up as a sense of fullness, warmth, or pressure in the prostate region. In a gland that already tends to swell with age, that extra congestion makes symptoms worse. The third problem lies in your pelvic floor muscles. These are the muscles that form a supportive hammock under your bladder, prostate, and rectum. They control the opening and closing of the urethra and help maintain continence. Ideally, during the night, they should alternate between light activity and deep relaxation. When you sleep on your stomach, with your lower back arched and your pelvis rotated, you often create a subtle tightening of these muscles. Your body is trying to stabilize itself. Over time, this pattern can lead to a pelvic floor that is overactive, too tense, too vigilant. Men with this problem may feel like they can never fully empty their bladder, or they experience a vague ache between the legs or around the anus, especially after a night of poor sleep. A fourth factor, less obvious but very important, is the effect of this position on your spine and nervous system. To breathe while lying on your stomach, you have to twist your neck to one side and often rotate your shoulders. This can create discomfort in the neck and upper back and lead to frequent micro-awakenings, even if you don't remember them in the morning. Disturbed sleep increases stress hormones and reduces the body's ability to regulate inflammation. A man who sleeps lightly and restlessly night after night lives in a state of physiological alarm. In that state, inflammatory processes become more active, sensitivity in the pelvic region rises, and all urinary symptoms feel more intense. You might be wondering, so does this mean every single man who sleeps on his stomach will damage his prostate? Not necessarily. Biology is not that simple. Some men can sleep this way for years and develop few or no symptoms. But in men who already have risk factors, age over 50, enlarged prostate, history of pelvic discomfort, sedentary lifestyle, or extra weight around the abdomen, this position can contribute to a perfect storm of pressure, congestion, and tension in exactly the wrong area. It doesn't usually act alone, but it can amplify other factors and make a borderline situation much more symptomatic. Now that we've identified the worst position for your prostate, lying face down with your pelvis compressed, let's talk about what you can do instead. The good news is that you don't need any expensive device, special treatment, or complicated routine. The main goal is to give your pelvis more space, your bladder more freedom, and your pelvic floor more chances to truly relax. For most men, the friendliest sleeping position for prostate health is on the side, with the spine aligned and the pelvis supported. Imagine yourself lying on your left or right side with a straight line from your ear to your shoulder to your hip. Your head rests on a pillow high enough to keep your neck level, not bent up or down. Your knees are slightly bent. Between your knees, you place a small pillow to prevent the top leg from twisting your pelvis forward. In this position, your body weight is distributed along your side instead of concentrating on the lower abdomen. Your bladder has room to expand forward and upward. Your pelvic floor can soften because it no longer has to stabilize a twisted spine and rotated hips. Another good option, especially for men who struggle with reflux or back pain, is lying on your back. When you sleep on your back with adequate support, Your pelvis rests in a neutral position. The bladder sits comfortably in the center of the pelvis, and the prostate isn't squashed between your body and the bed. A simple trick can make this even better. Place a small pillow or rolled towel under your knees. This gently tilts the pelvis and reduces tension in your lower back and abdomen. Men often report that this position gives them a feeling of openness and lightness in the lower belly that they rarely notice when they sleep on their stomach. Of course, changing a sleeping position is not like flipping a switch. If you have slept on your stomach for decades, your body will instinctively try to return to that posture. Many men start on their side and wake up on their stomach without realizing when they rolled over. That doesn't mean change is impossible. It means you need a strategy, not just a wish. The first step is awareness. Acknowledge, honestly, how you usually fall asleep and how you usually wake up. Do you start on your back and turn forward? Do you curl into a semi-prone position with one knee pulled up and your torso rotated? The more precisely you can describe your habits, the easier it is to interrupt them. Simply knowing that your favorite comfort pose may be squeezing your bladder and congesting your pelvis gives you a powerful reason to experiment with alternatives. The second step is to shape your environment. Use pillows as allies, not decorations. If you want to avoid rolling onto your stomach, you can place a firm pillow or even a folded blanket in front of your torso when you are lying on your side, so turning forward becomes less natural. A body pillow that you can hug with your top arm and leg can also keep you in a semi-side, semi-back position that feels safe but avoids full face-down compression. For back sleeping, the pillow under your knees can make the position feel so comfortable that your body is less tempted to twist forward. The third step is to prepare your pelvis for rest. Just before bed, spend a few minutes doing gentle movements. Slow hip circles while standing, a light stretch of your hip flexors, or lying on your back and letting your knees drop gently side to side. Combine this with deep breathing, letting your abdomen rise on each inhalation and fall on each exhalation. This kind of breathing massages the pelvic area from the inside and tells your pelvic floor that it is allowed to soften. A relaxed pelvic floor at bedtime is less likely to crave the bracing posture that often leads men into the stomach down position. Changing the position alone is powerful, but combining it with better evening habits makes the effect stronger. For example, reducing the amount of fluid you drink in the last 2 hours before bedtime can lower the nighttime filling pressure on your bladder. Emptying your bladder right before you lie down removes an obvious source of urgency. Avoiding large, heavy meals and alcohol late at night decreases stimulation of the bladder and reduces inflammation. Each of these steps removes one layer of stress from your pelvic area, allowing the benefit of a better sleeping posture to stand out more clearly. Let me share a couple of real-world style examples to make this more concrete. Imagine a 60-year-old man named Robert. He wakes up 3 times a night to urinate. His urine stream is weaker than in his 40s, and sometimes he feels like he needs to push a little to get started. During our consultation, he mentions in passing that he has always slept on his stomach, like a parachutist, one leg up and his head turned to the side. When I ask him whether he ever feels pressure in his lower abdomen in the middle of the night, he admits that he often wakes up with a heavy, full sensation, even when the amount of urine is small. In Robert's case, his prostate is moderately enlarged, but not in an extreme way. Instead of jumping straight into aggressive treatment, we build a plan. He starts sleeping on his side with a pillow between his knees, places a pillow in front of his chest to prevent rolling forward, reduces his late evening fluid intake, and practices deep abdominal breathing in bed. At first, he continues to wake up on his stomach once or twice a night, but each time he notices, he gently rolls back to his side without getting angry with himself. After about a month, he reports that he is now waking up only once or twice to urinate, and the sense of pelvic heaviness has faded significantly. The enlarged prostate didn't magically shrink, but the constant nighttime pressure and congestion were reduced, and his body responded. A second example. Michael, 67, has a long history of pelvic discomfort and worry about his health. His tests show mild prostate enlargement and signs of previous inflammation. He is extremely attentive to every sensation in his pelvis. He works long hours sitting and believes that sleeping on a very firm mattress on his stomach is good for his spine. In reality, it is placing all his body weight on the very area that bothers him the most. We talk about switching to a side-lying posture, upgrading his mattress to one that supports his body without crushing his pelvis, and using pillows to keep him in a more neutral alignment. Over several weeks, his nighttime pain episodes decrease, and his anxiety softens as he realizes that his habits, not just his age, were feeding his discomfort. These stories are not about perfection. Neither man became a textbook sleeper in one night. They are about understanding that your choices matter. You cannot control your birthday or the shape of your genes, but you can control how you treat your pelvis for 1/3 of your life, the hours you spend in bed. I want to be very clear about one more point. Adjusting your sleeping position does not replace regular checkups or medical advice. If you have burning when you urinate, blood in your urine, severe pain, or sudden changes in urinary habits, you should always consult your doctor. Changing your posture is a supportive strategy, not a diagnosis or cure by itself. What it does give you is a simple way to reduce mechanical stress on your pelvic organs and improve the quality of your sleep, which in turn supports every healing process in your body. If I had to compress everything we've discussed into one sentence, it would be this. The worst sleeping position for your prostate is any posture that presses your pelvis and bladder into the mattress for hours, and the most common culprit is sleeping on your stomach. By choosing side or back positions that give your pelvis space, you create an environment where your prostate can stay calmer, your bladder can signal you more reasonably, and your nights can become more restful. And here is the hopeful part. It is never too late to make this change. Whether you are 45, 65, or 80, your body still has a remarkable capacity to adapt when you give it steady, gentle support. You may not be able to erase every symptom, but you can often reduce their intensity, cut down the number of nighttime trips to the bathroom, and wake up with less pressure in your lower abdomen simply by changing how you lie down to sleep. As we finish, I invite you to pay attention tonight. Notice how you place your body on the mattress. Ask yourself, is this helping my pelvis relax, or is it pressing everything down? Experiment with a pillow between your knees, one under your knees if you lie on your back, or a body pillow to keep you from rolling onto your stomach. Give yourself several weeks to explore, not just a couple of nights. If this message resonated with you, consider sharing it with a friend or relative who wakes up often at night to urinate or who has always slept on his stomach without realizing how that might affect his prostate now. Sometimes a simple piece of information is the missing link that explains years of discomfort. I'm Dr. Susan Parker, urologist. Thank you for spending this time with me. If you'd like to keep learning about prostate health, male well-being, circulation, and practical habits for vitality in midlife and beyond, I invite you to stay connected, reflect on what you've heard, and continue asking thoughtful questions about your own body. Your nights are not just hours to get through, they are opportunities for repair. The way you sleep is a choice you make every single day, and that choice can move you closer to the comfortable, confident life you deserve.